Hi guys, I'm Dr. Elbert Cheng and I'm a double board certified facial plastic surgeon, and today we're going to be talking with Lindsay, who's going to be having surgery very shortly.
Hi, my name is Lindsay and I'm a medical assistant here at Cheng Plastic Surgery, and I'm going to undergo lower eyelid blepharoplasty. My reason behind this is because recently, with most of my adult life, I've had children, I'm a wife, I have always taken care of other people. Even being a medical assistant, I care to patients' needs and to my doctor's needs. And then also about 4 months ago, I underwent an organ donor transplant surgery where I was a donor for one of my girlfriends so she could receive a kidney. So I think right now it's just time for me to really focus on myself. This surgery is just a gift for myself this time, and I really need to focus on myself, so it's going to boost my self-esteem, make the outside feel like I do on the inside. So that's my reason behind this.
Lindsay, I think, approached me a couple weeks ago and said, you know, I need to take care of my eye bags. And originally I felt like, what eye bags? But I think sometimes makeup and things can cover up really well, and she does a great job in covering up, and she's beautiful. So I'll just let you explain what kind of led you to today, actually.
Okay, so I've been bothered by my eye bags most of my life. I have lost some weight. I have lost about 30 pounds, and I definitely notice my eye bags. I feel like I'm a pretty bubbly person, and just the outside looks a little tired, a little worn down, especially when I position my head in different light. I can definitely see them. I'm cautious about taking photos because I definitely notice them. Every time I look in the mirror, this is exactly where I look. So, and I've seen all the work that Dr. Elbert does, being one of his medical assistants. So I just figured he was the best man for the job.
So with Lindsay, she's 42, and we need to, when we do surgery, do things in a safe manner. So we're gonna do things through the transconjunctival approach, which is through the underneath surface of her eye. So it's not on the surface of her eye, but we flip her eyelid, and through the back surface we're gonna be operating. In that way, we're preserving all of the support systems of her lower eyelid. So her lower eyelid is like a suspension bridge, and we want to preserve, again, the cables that connect to the bone, and then the cartilage underneath the eyelashes that support the actual eyelid themselves. So with Lindsay, I think what's tricky is that she has very thin skin. So I think anything that's done, whether we contour the fat, whether we position the fat, even fat grafting or fat transfer from her can be tricky. So that's something that I've been talking with her about and thinking about. So I think my thought process at this point is we're going to contour the fat through that approach, which means that I'm going to take some out to fashion it. There is a possibility I would reposition some fat depending on how the surgery goes. After that, we'll close everything up and then deal with the outside skin laxity. We'll do that with CO2 laser, and then we'll approach lastly with some fat grafting from either her belly or her inner thigh.
I have a pretty good understanding about the surgery. I'm a little nervous, of course. You know, I'm doing this under local anesthesia, so I will be semi-awake during the procedure. Hopefully I won't remember anything. But yeah, I'm really excited, and I'll listen to all of his directions.
Yay!
Yay!
Yeah, there are different ways under like anesthesia that we could do for Lindsay. Generally, I like IV anesthesia, which is twilight, but general anesthesia for a case like this is perfect too. That way I know Lindsay won't move on me, and we can be assured that all I have to control is my own surgical technique and what I'm dealing with, instead of worrying about her moving. But anyways, she's chosen local anesthesia. She's going to do great. If she heals correctly, in a couple days she'll be able to see normally. I think she'll be able to go out. A little pink on the surface of the skin. I may take a little skin pinch depending on how much skin laxity at the end of the case, so we'll see about that. But I want to try to prevent any incision on the outside too for her.
For me, I just want to feel more confident. I, spend a lot of time on my skin, especially working here at Cheng Plastics. I've had, numerous lasers, fillers, toxins, and I feel like this is just something that I really need to address, and I just want to feel more confident.
For Lindsay, knowing her, she's just someone who goes and likes to jog and likes to run and do things, and she's always on the move. So I would caution her in terms of just holding back a little bit, not raising her heart rate above 80 or 90, not lifting anything too heavy, just taking it easy for a short time. And what is a short time? I'd say for this type of procedure, it's probably about 7 days. You can see where she has fat in 3 different pockets. Her most prominent pocket is the central pocket here. It's slightly bluish, and that's what happens with fat. It's 70% water, so when the light enters through the skin's very thin. It's going to show up as just a darker color. So central pocket, nasal pocket. On this side, she doesn't really have a lateral pocket as obvious, but there is a little bit of one that you can see. She has this tear trough that is visible as well. Again, on this side, on the right side, can you look up for me, Lindsay? Yep. The lateral pocket is a little bit more observant, or obvious, sorry. When we feel the fat, her bone's at a good position, so that's great. And her eye, in terms of how it projects, is at a great location. She has a little bit of depression here, so yeah, we'll deal with that in the OR. Yeah, okay, great.
Just really excited. I'd do it tomorrow if I could. So yeah, and I'm in great hands with Dr. Elbert Cheng.
See you in the OR?
Yeah, just see you in the OR.
See you in the OR.